Hello, everyone. We are in our knee series, and we are talking about total knee replacement and the recreational athlete. I'm Dr. Janae Brown, and I am joined by 4 fine clinicians at Physical Therapy San Pedro. To my left is
Dr. Daisuke.
And to my right is
Dr. Sandoval.
Dr. Bay.
So we're talking knees. We're in our knee series. If you're somebody who has maybe contemplated getting a total knee replacement and you're not sure if it's the right thing for you to do, or maybe you have some severe knee osteoarthritis and knee pain, and you have a friend or family member who's had a knee replacement and they had poor outcomes, this blog discussion is for you. We're talking total knee replacement, and we want to encourage you that if you do the right things and you take the right steps and you put in the time and effort, that you can have very positive outcomes post a total knee replacement. So Dr. Sandoval wrote this amazing blog for us today. And so he's going to give you a little bit of insight on why he was inspired to write this blog and why he wrote it about total knee replacement. Dr. Sandoval.
Yeah, so I decided to write this blog about this specific topic because I just recently discharged one of our patients here, one of my patients, who is a triathlete. He's an older adult, but he's also a triathlete. And he, very recently ended up getting this total knee replacement. And he came to us because he was looking for a physical therapy clinic that could tailor his program to his specific needs, because he still wants to continue with these high-level activities, the long-distance cycling, the long-distance swimming, and he is even considering getting back to long-distance running too. The only issue with that is his other knee is still bothering him. But that is something that he's considering in the future. So he's a great patient, great guy. I love him. And, the other day I discharged him and I felt really inspired to write about his specific case. And, given that we're doing these blogs on knees, I figured, okay, well, let's talk about someone and a case that's near and dear to my heart.
Yeah, Jose's totally a stud. I think he's a great client for us to talk about, and a great case. Because a lot of people are worried about having a total knee replacement and whether they can get back to these sports and recreational activities that they were doing before, cycling and running and swimming, things like that they really want to do. So I love it. Let's start with some anatomy. So some people, I'm sure a lot of people don't know what a total knee replacement fully is. So let's give everybody a little idea of what would happen if they underwent a total knee replacement.
Yeah, so I guess it's my turn.
To be anatomy.
To play with the model.
Good luck.
Thank you. So when someone undergoes a total knee replacement, what's going on is the cartilage on the underside of the femur, which is the thigh bone, and the top part of the tibia, which is the shin bone, and sometimes even the backside of the patella, which is the kneecap, that gets over time damaged. And what the surgeons do is they go in, shave off that part of the bone and the cartilage, and they replace it with metal and or plastic prosthetics so that you are able to bend the knee and straighten it out without having any issues. Ideally, without having any pain, without any loss of range of motion, though that comes later with rehab. And you regain the ability to roll and glide the knee as well as rotate back and forth. So that's pretty much what they're doing with the total knee replacement.
Yeah, awesome. So, seems a little invasive, right? Going in, getting out a saw and a hammer, and
Just a little bit.
It's like carpentry, as Dr. Bay reminded me.
Yeah.
So one of the things that we see a lot of patients deal with is pain post that. But we also see them they feel a lot better after the surgery once we move through some interventions, which we're going to talk about in a little bit. But Dr. D, talk to us about prognosis. How do people typically do with a total knee replacement? How are outcomes, and what impacts their ability to do well?
So for the most part, recovery is pretty straightforward for the most part. But at the end of it all, really just depends on rehab, right?
Right.
Same with any other injury, same with any other surgery. It really just depends on what you do after the procedure is done. Because ideally, if you just come out of surgery, everything's 100%, that would be ideal.
Yeah.
But that's not necessarily the case with any type of surgery. So, but the most important thing when it comes to that recovery process is the prior level of function and what you were doing prior to the injury itself too. So the more you prepare yourself, whether it might just be some prehab at a PT clinic or with a personal trainer or something like that, just to prepare yourself, that's optimal. It's not always the case for, I would say, majority of the people that we end up seeing, but it plays a very big part about what you do beforehand. As far as the lifetime of, or the longevity of the procedure itself or the device, 90% of knee replacements last about 10 years, but 80% lasts about 20 years. So that determines when you get the procedure done for some people too, because some surgeons recommend getting the procedure done relatively early on, depending on how that person's condition is. But they might push it off until maybe 5-10 years from that point and just do rehab instead for now, mainly because of the longevity of how long it actually lasts. Because if you say get it at like 30 for some reason, maybe it's a congenital condition or something like that, and that means it's only going to last till they're 40 or 50, which means they might have to get another procedure done afterwards. So sometimes you kind of have to push it off a little bit more, but not necessarily always the case.
Yeah. What are some things you guys experience-wise see that impacts prognosis from your experience with patients that have done well? Maybe it's good surgeons, maybe it's good rehab, maybe it's good prior level. We talked about prior level a little bit, but do you guys have any sort of experience from a client other than Jose? We're going to talk about him that has done well, and what are some things you guys feel like has impacted like strong prognosis?
Yeah, just like Dr. Daisuke was saying, that finding that sweet spot about the right period of time, I feel like not waiting so long that the joint angle is too deformed could have an impact in the flexibility after. And of course, making sure that you have an adequate amount of muscle to support yourself after surgery helps your prognosis.
Yeah. Do you have any personal experience?
I think weight loss has played a big part for some of my patients in the past where, and luckily the surgeon recommended it too, so it helped out, but they recommended a weight loss program prior to having it, and that made the rehab process a lot easier too. So
Yeah.
yeah.
For me, it's the client's commitment to their physical therapy program. As long as, if we have a good surgeon, which most surgeons do this procedure the ones that do it pretty well because they do it all the time. And so it's just, they've gotten really good at it.
Yeah.
So I've had maybe one case where it was a bad procedure essentially that left the patient with a poor prognosis. But for the most part, it's hard. This is probably one of the hardest rehab procedures because you're really stiff and in the beginning post-surgically, right? So you have to commit to this exercise program, doing it daily. You really have to do it daily, especially range of motion, right? And then, and yeah, I got to come to PT. I see the ones that come the once a week PTers struggle. I've seen, and so that for me, that's been, I think, an impactful, just commitment and consistency to their PT program. Cool. Okay. So let's move on to intervention because we're talking a little bit about the things that we would have you do as a patient for us if you had a total knee replacement. So Dr. Bay, talk to us about what intervention looks like. And we'll kind of talk as a team about those phases.
Yeah. So once you have surgery is when the fun begins.
You get to see us.
The doctors do their job, but then there's a big road ahead of work and commitment from you in terms of recovery. So 3 phases to your rehabilitation. Initially, what we call the early phase, where we're just post-op kind of controlling pain and swelling and getting going, coaching you on how to move properly without harming yourself. And the middle phase, where we start to amp it up a little bit, get more strength and flexibility. And then our last phase, where we're really preparing you for what are your goals.
Yeah, returning back to sport and activities and
Yeah.
things. So early phase, talk to me about some things you guys do in the early phase of rehab. Anybody?
Yeah, so if in that, like you said earlier, you are probably going to be very stiff coming out of this surgery. So one of the main things that you want to get early on is that range of motion back. So you want to be doing just as an example, something like a heel slide, just as an example, to get that knee to bend a little bit more. You want to focus on also getting some quadriceps strength back and control. So that's going to help you straighten out your leg a little bit more. So you maybe want to do something like a quad set or a short arc quad or a long arc quad, depending on where you are with how much strength and control you have.
Yeah.
The idea is to get those muscles engaged, that control for those motions, so that you can actively get that range of motion back.
Yeah. Do you guys find in the early phase that it's harder to gain bending of the knee, which we call knee flexion, or extension with your total knee replacement patients? Anybody?
I think it depends. I would say most of the time it's flexion, mainly because there's a lot of swelling in the area. So even if the joint itself is mobile enough, the swelling kind of gets in the way. But at the same time, I try to promote extension as much as possible at the very beginning because that allows them to stand better and walk better. So I think at the very beginning, I try to emphasize getting extension first, and then flexion is just a gradual process beyond that point. So
Yeah. I feel like once you hit that sweet spot, like when you hit like 95 to 100, you're like,
Well, yeah,
you're
once you can get around the bike.
yeah, exactly. It's like getting that sweet spot.
Smooth
Yeah.
sailing.
Yeah. But I think a total knee, and let's say we were compared total knee to an ACL, where you really are going after, like, extension is that thing that you have a hard time getting. It's those that flexion. Sometimes there's like that space where it's just really hard to get that range you want to get over to that sweet spot. So, so we talked about range motion, getting the quads firing. What about in the early phase, those first 3 months? What about function? What are we really working on functionally for those early phase patients? What are we trying to get them to do? Anybody?
Safe transitions,
Yeah.
right? Coaching them on their gait training, how to walk properly again, how to do the stairs properly, really safe moving and restoring normal movement.
Yeah.
The more they use their muscles like before, the quicker things are going to progress.
Yeah. Is there anything that really bothers you when you get a fresh total knee replacement patient, and like they haven't been educated on something like from the surgeon, or is there anything that
Well, we had a case a few months ago where the person just was raring to go and did too much too fast. So then the pain really rose again. The swelling got out of control.
Yeah.
So that's really big, is listening to your body and making sure you're pushing at the right pace.
Yeah, for sure. Anybody else? No? Okay, let's move to the middle phase of rehab, which is going to be focused on some different things. So what are some things you guys do in the middle phases of rehab? So that's like you would say like the 3 to 6 month range. Are you guys consider that? Or, okay. Yeah.
squats and deadlifts.
Squats.
Yep.
Dr. D.
Yeah.
He's good for
Absolutely.
coming in with the squats and the deadlifts.
Yeah. This is
Yeah, so
basic.
weight-bearing strength.
Yeah.
Yes.
Yeah.
Weight
Just
bearing
strength work. This is typically probably the longest period, and I guess that's the stage that never really ends or shouldn't end for most people. Mainly because regardless if they get discharged or not, or they get back into their sport, the strength part never really ends. So we really try to emphasize the education on that too, that
Yeah.
it shouldn't end.
Teaching them the basics
Yeah.
of strength training so they continue to work those muscles. Yep, for sure. Balance is probably huge here too, like just higher level balance activities, right? Yep. Anybody else?
Endurance,
Endurance. So,
longer walks, longer bike rides.
Okay.
Yeah, I think in this phase, this is when we started to get into cycling again as well, and just really monitoring that and progressing that for Jose, and using that as a tool to also allow him to get stronger. So he would go on his mountain bike and go on, some certain off-road trails to work on some strengthening, right? And then he would get on his road bike and go for more distance to promote endurance in his legs. And then once he ended up clipping in, we started working on his hamstring and glutes, right? So using that, something that he loves to do as a tool to, further progress his strengthening and conditioning, was something that we ended up doing around this stage as well.
Yeah, initiating that right there.
Yeah.
Yeah, good stuff. Okay. Anything else on the middle phase of Strength is key. Single leg activity, single leg strength, step up, step downs, lunging. Dr. D loves his split stance lunge, split squats.
Split squats.
Split squats. Is that wrong? Yeah.
Save that for another blog.
Yep.
It's loaded.
Okay, cool. Okay, late phase. So late phase is interesting because some people we don't get to keep them for the late phases depending on, but we are talking about the recreational athlete here. So this is a late phase person. They're going to be with us returning back to whatever things they're doing. I think Jose's late phase was a little bit altered because he's going to have another knee replacement, right? So he's kind of he's going to be able to do so much, but that other knee is going to stop him from really getting to his top of the game or whatever. Also, sometimes like insurance and the ability to pay during this phase can be limited. So sometimes the late phase stuff is moved to like a personal trainer or a strength coach, or it's cash pay services with a physical therapist. But if you're an athlete and you want to get back to that, you have to work out the late phase with somebody. I really think that you are going to set yourself up for poor outcomes if you don't. So let's talk about late phase things that you worked on with Jose, and we can kind of all explore some late phase things that we work on with our clients.
Yeah, so I would say within the past month, maybe month and a half, we started introducing very gentle, explosive type movements, power-driven movements, such as a double leg snap down or just an explosive sit to stand, right? Just getting him used to producing power through his legs quickly and efficiently. And then we transitioned that into just very small little jumps, something that he could realistically perform considering the fact that his other knee is still bothering him. We also introduced very gentle plyometric activities like pogos, small little skips, shuffling side to side. The shuffles side to side were probably one of the things that bothered him the most, given that his other knee is still an issue. But these are things that generally we would introduce and then progress as the athlete continues to improve, right? Yeah. So that's what we introduced right now recently, and then as we transition into this phase of him being discharged, he's going to continue that and progress that on his own. And then obviously if and when he does end up getting a second surgery for the other knee, we'll progress that even further because now he'll have recovered from 2 surgeries.
Yeah.
He'll be all good.
He'll have 2 knees.
2 new knees.
2 new knees. Okay, so some late phase things, examples of clients, patients you guys have had that have been athletes and had total knee replacement. What are some things that other things you guys would add into that or that you might do in this phase that Dr. Sandoval didn't talk about?
We'll probably get into a little bit more advanced plyometrics, whether it might be bounding, hopping, advanced skipping, going into some acceleration, sprinting work, depending on what type of athlete they are, what kind of sport they're in. Well, at the end of it all, it doesn't really matter what sport they're in. I think sprinting can be beneficial for anybody anyways, as far as power goes. And
tell my daughter that because she won't sprint.
That's too bad.
How does she want to swim fast?
She's like, I swim. I don't sprint. I'm in the water. I'm not in the land. But again, I have to keep going. You need to know how and feel good with this because it's important. Yeah, like you just said, you got to cross train. You got to be able to do it all.
Connects the dots in the body.
Yeah, yeah. Even our strongman Martins, he's out in the sand sprinting right now and doing stuff like that. So, I mean, you got to sprint in certain events. You got to move fast.
It's like Dr. Bass said a couple of vlogs ago. You got to keep things balanced, right?
It's all about the balance. So plyometrics, hopping, bounding. What about sport-specific things? So like, what are some things? Let's talk about like Jose. He's cycler, right? He's triathlete. Cycle, swim.
Cycle, swim, run. Yeah.
So if that's your client, what are these? What are you really working on in these phases? Let's pick one of those. If you're a swimmer.
If you're a swimmer.
What are you going to tell your patient in the late phase if they're swimming?
Swim.
Oh, yeah.
Anybody know?
Honestly, yeah. Just swim more.
I think that swimming is one of the things that's kind of challenging for like skill work in the clinic.
Yeah.
there's only so much you can really do.
Yeah.
So I
but
think
this would be
it's-
more education, right? This would be
Yeah.
like, we're going to tell them to go do, like, for example, a baseball player right now. I can't throw with him in the clinic, but I'm like, you need to go throw, right? You need to throw this many pitches and you need to come back and tell me how it feels. So this is like,
Coach
okay,
the load, the intensity.
coach the load. Yeah. Coach the load, coach the
True.
intensity, right?
Scale it.
Yep. Scale it
Yeah.
and find out what they need to be able to do. What were they doing before? And like, how can we start from zero and get back to that? So
Yeah.
whether it's they were a sprinter in the water, whether they were swimming long distance, whether they were backstroke or, breaststroke, whatever stroke was their stroke, let's figure out, we can't do it here. We can't go with them and do it, but we can say, okay, I want you to go out there and tell me how it feels and come back.
Yeah, and then obviously as they go back into the water and start practicing some of these higher level movements, something might come up too because they are reintroducing an activity that they haven't done likely in a while, right? So
Yep.
you then
Always.
manage
Biggest problem.
those little
layers.
nicks,
That's the things we hate, right? Because we don't get to control that. It's like we can tell you what to do, and we're always kind of guiding on what we think is best, but you're going to do what you want to do, and oftentimes
At the
not
end of
listen
it
to
all.
us. And
We'll
sometimes
be lucky if you tell us.
yeah, and sometimes we get it wrong. That's why rehab is like, because we
Well,
are not
nobody's-
sure all the time.
And nobody's the same.
That's right. Everybody's different. Yeah, yeah. Cool.
Maybe
Okay.
your swim stroke looks a little different than somebody else's.
It's true.
Sure.
Yeah. So there's so many factors, right, involved in it. So our point in this whole discussion is to encourage you guys that if you are a recreational athlete or even a competitive athlete, and you want to have a total knee replacement, you can have really strong and great outcomes if you do the right things. Those things include, picking a good surgeon, finding a good physical therapist, committing to your PT, showing up, doing your home exercises, communicating well with your team, and committing to the strength work, I think, ongoing post, because it's like your knee is not going to really feel like your knee for probably a couple years. Just like when, it's going to take a good couple, even though you might be back to things, doing things well, it still takes time for the body to accept that this is you.
Robot
This is yours.
status.
Did you want to share anything else about Jose in particular?
I just want to reiterate kind of what you just said too right now, which is one of the things that really made him successful in this journey was how invested he was in his rehab, right? He was very, very intentional about all of the exercises that he was doing between visits. And we would spend a significant portion of our visit each time that he would come in, discussing what he was going to be doing outside of rehab, outside of the clinic. And that is very important if you really want to get back to those higher level activities. And, going along with that, our communication was really, really good in everything that he tried, everything that bothered him. We talked about it and we figured out ways to get him past those little hurdles. So, going back to what you said, we are lucky if our patients decide to share those little things with us. And, we hope that, that trust and communication is developed, because then that just speeds up the process and makes things go, so much smoother. And, we can help you get to those goals that much quicker.
Yeah, it's good. Thank you, Jose, for being a great patient.
Yeah. Honestly, he's great.
We
I love him.
We love the
I
good
love him.
ones.
It's
Love you,
very
Jose.
inspirational
Yeah.
to watch.
Be a good patient for your physical therapist.
Please.
All right. Well, we're wrapping it up. We hope you enjoyed learning a little bit more about what a total knee replacement is, what that looks like in terms of the surgical procedure, what your outcomes would look like, and things that you would do with us in rehab and how to be successful. So stay tuned, because we are in our knee series and we're going to tap into another diagnosis that you might be interested in, or a problem that you might have. So stay tuned for that. Check us out on Instagram at Physical Therapy San Pedro, Facebook as well. You can subscribe to our blog and subscribe to our website to get all the free tips and information and things that we put out and content we put out fresh as it comes out. And I think that is it. We will see you guys next time. Bye.